Hello everybody, my name is Dr. Priyank Solanki. I am an eye surgeon. Today I will be discussing with you about an important topic called as computer vision syndrome or called as CVS. This is one of the most common issues which we see in a regular daily OPD. About 60% or 70% of a patient between the age of 20 and 45 or even 50 we see with these issues. So in this video, I'll be talking in terms of 4 points. First, what is a computer vision syndrome? Second, what causes this? Third, what are the signs or symptoms in this? And fourth, how do we manage this? Let's go on with what is the computer vision syndrome. Computer vision syndrome or CVS, or now what we call them as digital eye strain, and I'll tell you why we call it as digital eye strain nowadays, is an eye issue which is frequently faced by many people now, specifically IT professionals who are on screen time for an extended length of time. So there are studies which have shown that about 70% of people working in an office will be suffering with one or the other form of a computer vision syndrome. Now that's a huge number, but most of them do not know that they are suffering from this issue. So in this, I will be talking to you about how to identify them and to know more about them. So first is what is a computer vision syndrome. Now, initially we were calling this as a computer vision syndrome because most of the work was on desktop. Now, with the advent of smartphones, iPad, tablets, which have become more mobile, these are now called as digital gadgets. And hence, now this has been converted or synonym with digital eye strain. It's not more of a syndrome now, it's more of a strain because the work which is given to the muscles due to these digital devices is more, and hence there is a fatigue of the muscles in the eye. This causes the digital eye strain syndrome. So what are the causes now? So most common or the majority of the time is the extended length of work which you do on these digital devices. The patient or the person will have long hours of work, no proper breaks in between, improper lighting which he might be sitting in on, and the screen font size might not be larger. So what are the symptoms that we generally see in this? Patient can have redness, watering, itching, irritability or pokey sensation in the eyes, sensitivity to the light called as photophobia, excessive tearing or excessive watering from the eyes. Sometimes they might also feel dryness in the eye. There might be sometimes swelling around the eyes also. There might be headache also. Patient in the evening times might face irritability or becomes more sensitive to his colleagues around. Now, these symptoms can be in combination or all of this. It's very rare to see that we see all of this in a same person, but the combination of this is generally seen. So you might be feeling that when you're on screen for a long time, the most common thing is you feel fatigue. You feel like pressing your eyes. You might feeling the closing your eyes, right? Watering will be there. By the end of the day, you see even tearing or redness. So these all are one of the symptoms that we see. So these are generally the symptoms which you see in a digital eye strain or computer vision syndrome. How do we manage them? So there are 5 basic cardinal points which I would tell that you should follow. The first and the foremost is the 20-20-20 rule, which means after every 20 minutes of screen time, take a break 2 minutes, focus on a distance of 20 feet. This helps you to relax the small muscles of it, which will help you to see much better. Second point is blink frequently. Now when you blink, the tear film spreads. This is one of the most common factors I see. The third thing is the font size of the screen. Generally, most font size on the screen is very small, so that we can put more fonts on a single window and less time to scroll. This is not right. You have to increase the font size. You can make it up to 14 or 16 size, okay, and use the screen. If you have to scroll, but do not try to make it small. That put more stress because you have to go closer to your screen to visualize the words or the image or the object. The fourth point is the ambient room lighting. Try to see to it that the screen lighting and the room lighting are ambient. Don't keep the screen light too high or too dim. It should be according to the room light. Fifth is the fan or the AC. Now see to it that the flow of the air which comes from the AC or the fan is not in front of your eyes. What happens is when this wind blows along your eyes, it evaporates the moisture from your eyes and this causes dryness. Okay? So these are the contributing factors for your digital eye strain or computer vision strain. These 5 points if you follow, your majority of the time, your 80% of the job is done. Now, along with this, there are some other additional things which you should know that how to manage when you're in front of a screen. For example, when you're working in front of a screen, you should see that the screen's height is just at or below the level of your eyes. The inclination or the bend of the screen monitor should be about 20 degrees or so. Try to sit in a chair posture which is straight, your feet firm on the ground straight, okay, and do not keep your hands or elbows bent long. It should be almost at a 90 degrees so that you can work clearly without a problem on the screen. So these are the additional things which you should know that you're working in front of a screen. So these are the modification of your physical body. The other thing is with what we see that patients all have shoulder pains or neck pains, sometimes even back pain. Now these are the contributing additional factors which you see on working for a screen for a long time. The doctor, when you visit your eye doctor, he might tell you all these things to follow, and also he would prescribe you some medications in form of eye drops. Now these are lubricating drops or moisturizing drops. Now based on the type of dryness you have, he might prescribe different type of lubricating drops. Okay, so these drops will be used onto your eyes maybe 3 times, 4 times, 6 times based on the severity of the dryness and to be used by the patient or by you. When you put the drops, see to it that after putting the drops, close your eyes for about 2 to 3 minutes so that the effect of the drops stay longer. What many patients also do is that they put the drops, close the eyes for about half a minute or 30 seconds, and then they're open and then back to work. You should give adequate time for the drops to spread and start its activity. So about 2 to 3 minutes is on an average required. Okay? So put a drop in each eye, close for about 2 to 3 minutes, and then you can go back to work. So the effectivity and the efficiency of the drop stays for longer. The drops can be given for a month or 2 or longer based on the severity type of the dry eyes according to the doctor what he says. Okay? So this in short was about computer vision syndrome or digital eye strain as we doctors call it today, and how to manage them. I hope this video was informative and helpful for you. Thank you.